Good morning, everybody, and thank you for joining us this morning. We'll get started in just a minute.
Good morning.
Good
Finally.
morning.
Morning.
It's all right. I've been on hold.
We're just waiting for a few more to join us. We'll get started in just a minute.
Tell Tony I said hello. Harry says hello, Tony.
Morning, Harry. How you doing?
Morning. Morning, Tony.
All right, good morning, everybody. Thank you so much for joining us for this very important workshop titled The Dangers of Fentanyl. A huge thank you to the panelists who have taken the time to join us today. And really, honestly, a big thank you to Charles Mchugh, who really had the insight and determination to put this together for this very, very, very important topic. As you can see, all over the news, all over the media, there's so much information out there about what's going on in our communities. So this is such a crucial time for this. So thank you on behalf of the Chamber. For those of you who are joining us as attendees, if you have any questions, you can use the question and answer function at the bottom or the chat, and I will get to those at the end. But I would like to turn this over to our chief, our coach, Larry Mchugh, to kick us off.
Thank you very much, Johanna. And just to kind of a follow up on Charles, he's just done a magnificent job for us here at the Chamber, especially with our REP program, which is really bringing people back to work that have had substance abuse problems. And what we have found with the vast majority of these, they're coming out of corrections also. So we are getting people back to work that have had dual problems, one of which it deals with the substance abuse, second, corrections. And we've had great success. And I know some people are, some of our employers on this. I appreciate people taking the opportunity to hire the people that want to try to turn their lives around. So Charles, great job. And we've got a great leader in MCSAAC, in Tony Salvatore, the town manager in the town of Cromwell, also a former police chief, long time Chamber supporter. And Tony gets it as far as getting involved with us, getting involved in the community, and really trying to stress the importance of what you're doing today with this panel to try to help people straighten their lives out. And maybe other people that get on can help somebody in their family or in their one of their employees also. So I want to have a huge shout out to our panelists who has given up a great deal of time, and turn this over to Tony Salvatore now for a couple words, and then to introduce Charles.
Thank you, Larry. And I can't say enough about MCSAAC. I got involved back in 1992 when I made police chief by the late Mary Amenta, who was a great mentor of mine, heavily also involved in MCSAAC. And as a law enforcement officer and ultimately a police chief for 23 and a half years, firm believer of prevention, I think it's extremely important. And unfortunately, the state doesn't do enough in that arena. I want to thank our panelists. I think this webinar comes at the most appropriate time. One only has to look to Baltimore and unfortunately to members of the United States Military Academy who unfortunately engaged in apparently cocaine usage that was laced with fentanyl. I know this is a big concern for our first responders. All our first responders are now carrying Narcan. So I think this webinar comes at the most appropriate time. I too just want to say a few words about Charles. Over the years, I've worked with a number of individuals that have been the executive directors and leaders of MCSAAC for us. You can't ask for a better individual than Charles Mchugh. Charles gets it. Charles speaks from both sides of the street. And I'll tell you, you sit down and talk with the gentleman, and he is one of the best persons for this job, along with getting individuals back to work. So with that, no further ado, I'd like to introduce Charles Mchugh. Charles, take it away, and congratulations on another great webinar. Thank you.
Thank you, Anthony. Thank you, Johanna. Thank you, Larry. And I just want to thank each and every panelist that are on this morning to get this information out there, and just being, again, myself in recovery years now, and I know the stresses that can come upon one individual, the communities, and it's just an amazing, amazing time in my life right now to be able to be a part of the solution as opposed to being a part of the problem. And I just want to thank each and every one for being here. And I'm not going to go on any further, but this morning we have some very, very, very good panelists on this morning, prestige people. I esteem them very high. And we have Dr. Alan Craig from Hartford Healthcare. We have Daniel Bryan from the Community Health Center. We have Reverend Robert Anderson from the Ministerial Health Fellowship, Anna Gopian from Tri-Circle, and we have Lisa Dean, the founder of Demand Zero. And at this time, I'm going to bring on Lisa Dean, but I'm going to have Anna introduce her as to give you a bit of her background. Anna?
Yes, and thank you. I am Anna Gopian from Tri-Circle, and I have the honor and privilege of introducing a very strong advocate and an amazing woman, mom, and I'm really happy to say friend. So I wanted to bring this slide on and let you all get to meet Lisa Dean from Demand Zero and some of the amazing things that she has to share with our state and communities in Connecticut.
Thank you so much, Anna. I very much appreciate it. Thank you, Charles, and everyone for having me. I appreciate it. Well, my son, Joe Dean, died at the age of 23 years old of a pure fentanyl overdose. Joe was a tremendous athlete. He was extremely funny. He was quick-witted. He loved his family and girlfriend dearly. He was our baby boy, and Joe was a heroin addict. He took a Percocet sophomore year in high school, and he said, I love the way it made me feel. And he took another one, and he took another one. And before we knew what was going on, we had had no prior experience with drug addiction. Joe was in a full-blown addiction. We had actually thought he was drinking to excess. That followed with tons and tons of groundings and taking the phone away and so on and so forth, until we finally admitted to ourselves, I guess, that he did have a problem. And we set on our journey. And that included detox centers, rehabs, IOPs, a sober house, regular counseling, and a MAT program. Joe was sober for months. He was doing so extremely well. He was asked to drive a friend of his to the train station in New Haven. He was triggered somehow and used and died December 7th, 2018, although he lingered so that he could donate organs. And I'm pleased to say he saved the lives of 4 people with his organs. So anyway, because of how he died, because of his journey, I started a 100% volunteer nonprofit program called Demand Zero. Our mission being, we provide resources for law enforcement in order to fight drug trafficking, not only in the city of New Haven, but all surrounding communities throughout the state of Connecticut. We do this because of the fact I felt that, what if Joe couldn't have found the heroin that day? What if it had been tough to do? Maybe it would have given him 24 or even 1 hour to think about it, to come home. Unfortunately, many parts of our state are saturated with drugs. So from there, we met with the New Haven Police Department. And I'm proud to say we even became a member of the New Haven Police Department's community program. And we started with actually donating 2 drug detection dogs, which we're very proud of, Bruce and Farley, and also a canine police vehicle. Since then, we've also helped with programs of education and awareness. I feel that, and I think that Chief Salvatore just said something, I don't feel the state is doing enough in terms of prevention and awareness. And then thank God there are so many of us nonprofits that are willing to speak up and put time into this along with our volunteers. This is a billboard that I felt strongly about putting up in New Haven. It did get some attention because back then in 2018, there wasn't a lot of people talking about fentanyl like there is today, thankfully. Toward that end, we went into an education program on counterfeit and pressed pills, a subject that I still come across people that don't know about this. And I hate to tell you, but that includes teachers and nurses and students and even principals. So we created a film called Finding Hope. Finding Hope is a 17-minute film. It is not a documentary. It's a story about 2 teens and it's a tough subject matter. There is a death involved. There is some very strong language. However, we have found through screenings in schools and colleges are coming up actually, that even the senior teachers are saying this is absolutely appropriate for 6th grade and up. I'm pleased to share this with the entire state of Connecticut for free. It is a tool that you could use along your prevention journey. As you can see, the cast there includes 2 gals that I have acted with before in a anti-bullying play actually, and our directors in the back. Very special to me is 2 gentlemen that I've been working with now for about 3.5 years. They taught me so very much about drug addiction, the whys and what fors, and how to talk to people about my son and our journey. And that is Leonard Jihad, who is on the left-hand side of the screen. He's a director of Connecticut Violence Intervention. And on the right side is William Outlaw. William actually took me on a ride after Joe had passed away. I hadn't been near where he took his fatal dose, which was a McDonald's on Whaley Avenue. And he took me by and he showed me parts of New Haven I never knew existed. And we talked to people, we talked to sex workers, and we talked to those addicted. And it was an eye-opening experience that this epidemic, this national health crisis affects all of us, all ages. And I am so proud to do what we do. And I'm so proud of my volunteers that help us to raise money to do the things we do. Now, if anyone would like to screen this film at your church or your organizations or your schools or whatever, simply direct message me at the Demand Zero Facebook page. All right, and I will send you the link and the password. On the end, at the end of the film is a frame which says, you know, if you are in distress or you need some help, please dial 211. If you have friends outside the state and they would like to use this film, let me know. We can change that out. That is for a fee. It's nominal, but we can change that out to reflect what emergency number they would use for their state. And that is us standing on the steps of the New Haven Police Department back when Chief Anthony Campbell was heading up the department. And I had met with the chief right after Joe went away. And I said to him, Chief, what can we do? What do you need? And he said, Lisa, I need everything. And so we've set out, and we've given other monetary donations to do what they need to do. And we're very proud of that. We work with Intern Chief Renee Dominguez, and she could not be more helpful and supportive of what Demand Zero does. And thank you again. Thank you so much for your attention. One last thing. This is probably one of the most important initiatives we've embarked on. Last year in August, we went down to Washington, D.C. to march in front of the Chinese embassy to tell them politely to please stop sending precursors into Mexico to make illicit fentanyl with. We met a man there by the name of Jim Rao. Jim heads up Families Against Fentanyl. He has started this campaign to get illicit fentanyl classified as a weapon of mass destruction. We are the New England contingent, so to speak, myself, Christine Motto Gagnon, and Elizabeth Fitzgerald. Since then, four congressmen have signed on, and we're actually working with them, and a resolution has been drafted by a 5th congressman out in Ohio. We're really proud of this. You can learn more about this also on Demand Zero. Thank you from the bottom of my heart for everything this panel does, and good luck to everybody. Thank you very much.
Thank you, Lisa. If you would be willing to put your name and contact information in the chat, and if it's not visible to all public, then it can be made available through the follow-up.
Doing that right now. Thanks, Anna.
Okay. So now, moving on, are we going to show the slide or no?
I've got slides, Charles, I can
Okay,
share.
so we're gonna move on to Dr. Alan Craig, who is of the Hartford Healthcare. Thank you so much for being here, Dr. Craig.
Thanks for having me, Charles. I think this is a really important topic, as we've just heard. And Lisa, that was very powerful, and interested to hear about some of the things your organization is doing. On January 13th of this year, many of us heard on the news about the poisoning of 3 teenagers at the Sports and Medical Sciences Academy in Hartford. And tragically, a 13-year-old died. The news about fentanyl being in the school was terrifying, understandably, to the parents, teachers, and administrators in the Hartford Public Schools and across the state. But as we just heard, fentanyl has been around for a while, and it's not new, and its presence is growing. What I want to accomplish in the next 15 minutes or so is for people listening here today to know what fentanyl is and how it affects the brain and the body and what the potential harms are. Be able to identify some of the major risk factors for fentanyl poisoning, and then understand some harm reduction strategies. So fentanyl is a very potent, very strong synthetic opioid. A synthetic opioid means that it is not derived, it doesn't come from the poppy plant. It's actually made chemically. And as we heard Lisa say, the actual fentanyl, illicit fentanyl substance or precursors for that substance come from outside of the country, in China and through Mexico. It's 50 times stronger than heroin, and it can get into the body by being injected, smoked, snorted, and eaten. This slide here represents some of the stuff we just heard about in the way fentanyl and fentanyl precursors are getting into the country through the ports and across the much of it across the border in Mexico, coming from China to Mexico, and then up through the border. One of the drivers behind the increasing presence of fentanyl has to do with a business model, and a business model where a kilo of fentanyl, where small amounts are incredibly potent and give the same and stronger effects than much larger amounts of heroin or opioid pain medication, opioid analgesics. The profit margin, and this came from 2018, where a kilo of fentanyl might bring in 1.3 million, and the kilo of heroin, which is much harder to get into the country, comes from plants that are grown and tended to and then transported and processed. The profit there was only $75,000. You can see from a business standpoint, a driver there. Once the fentanyl is processed into a usable form, it can be cut into cocaine. And I remember a number of years ago, one of my patients who had a problem with cocaine, a cocaine use disorder, overdosed and was revived with naloxone in the emergency room, and very suspicious and concerning, since she did not use opioids, and it had been adulterated with fentanyl. Fentanyl is pressed into these fake pills. We heard a little bit about that. And it can also be used on its own. And there's a little picture there in the corner showing some of the small bags and the hair bands that tie those bags up. And I've seen pictures presented by law enforcement before of these little bags torn into pieces and laying on the ground, and the kind of thing you wouldn't even notice over in the McDonald's parking lot or at the convenience store parking lot. So why is fentanyl so dangerous? Well, because it is an opioid, and all opioids affect a number of different pathways in the body and the brain. Opioids are used medically to address pain. And so there are these what are called mu-opioid receptors in the brain and in the spinal cord that are targeted by opioids to manage pain. So the thalamus in the brain and the dorsal segment of the spinal cord. There's also pathways that have to do with making people feel relaxed or feel high or feel good. And that's in the reward pathway, the nucleus accumbens, the ventral tegmental area of the brain. And that's why people like it when that part of the brain gets triggered. It's a very rewarding experience. There's also part of the brain that has to do with cough suppression, and that's less well understood. That's why there are some cough medications that you need a prescription for that have codeine. And some people may have heard of, there's even songs about sipping syrup that often refer to these codeine-containing cough medications. Unfortunately, there's also a part of the brain and the brainstem, the respiratory center, where the opioids combined. And when the opioids bind there, it suppresses our drive to breathe, the respiratory drive, and it decreases the sensitivity of our chemoreceptors for carbon dioxide. What happens is when you don't breathe, carbon dioxide levels go up, and they trigger these receptors to get you to start breathing and breathe deeply. And if those receptors aren't working and you are sedated and your respiratory drive is decreased, that's what can lead to less oxygen in the brain, anoxic brain injury, and even to death. The cartoons here around the sides just show the different parts of the brain and the body that are affected by opioids. Up in the upper left-hand corner, it shows the opioid molecule attaching to the Mchugh receptor. When fentanyl binds to these different receptors in the brain and in the body, it causes different signs and symptoms. So if someone is intoxicated with this substance, they may have a decrease in pain. They may have this euphoric high feeling. They can be sedated, sleepy, overly relaxed, to the point that they have decreased consciousness or they nod off. One of the telltale signs is that the pupil in the eye becomes what's called pinned, very, very small, like you're putting a flashlight into someone's eye. There can be itching and redness in the eyes because of a release of histamine. Opioids can cause that. Because of the effect on the gastrointestinal tract, there can be constipation, nausea, vomiting, and with the effects on the heart, you can have decreased heart rate, low blood pressure, and as we mentioned, the respiratory suppression. So these are the risk factors here listed for addiction. They're also the risk factors for someone to misuse addictive substances like fentanyl. There's a large genetic component. More than 50% of people who develop addictions, more than 50% of the risk comes from having genetic predisposition or family members that have active substance use disorders. Both males and females, as you guys know, are vulnerable, but females tend to develop substance-related problems using the same amount as a male, much quicker, much faster, and have more severe complications. People with underlying psychiatric disorders, anxiety, depression are at greater risk. And the more potent a substance is, the greater the risk of developing an addiction. With fentanyl, because it is so potent, the addiction, the substance use disorder, the physical dependence can develop very, very rapidly. Environment plays a big part, and Dan's going to talk more about how environment can impact someone's predisposition and vulnerability, and age. So the stage of brain development plays a huge role with people under the age of 24 being at greater risk, with a significantly increased risk of developing problems as one gets younger if they are exposed to substances. This is related to brain development and myelinization of the brain. The last part of the brain to develop is in your 20s, and that's part of your prefrontal cortex, the part of the brain that has to do with wisdom, with making decisions. Should I do this? Should I not do this? The go, no-go function of the brain, less developed in adolescents and young adults, more developed as you get older. The brain is designed this way because it's really important for adolescents who seek out novel experiences to learn new things. And the brain is developed accordingly. So risks may be underestimated, and intense desire to seek new things is amplified. And that's how our species has evolved. But it plays a tremendous risk when you have a substance like fentanyl that is so powerful, so potent, and potentially fatal. In the past, someone may be drinking alcohol, experimenting with marijuana, and there's consequences to that as well. And hopefully people learn as they get older. But with fentanyl, the margin for learning is eliminated. This slide just shows you that 90% of adults who have substance use disorders started using substances before the age of 18, and 96% before the age of 21. I'm a child and adolescent psychiatrist and an addiction medicine doctor, so I'm particularly concerned about the impact of addictive substances on adolescents. This slide here shows you the addiction potential of a number of different types of drugs. As an example, look at cannabis. 9% of people that ever use it will develop a cannabis use disorder, whereas with nicotine products and tobacco, over 30% will develop that problem with just one use. Although the more use and the more potent and the more frequent, the greater the risk. However, with adolescents and young adults, the risk for developing a cannabis use disorder under the age of 18 goes up to 17%. And under the age of 15, and I see many patients who started or are using at that age, using 4 times a week, which is not unusual, 25 to 50% risk of developing a cannabis use disorder. This slide indicates how synthetic opioids like fentanyl have dominated the roster at the medical examiner's office in terms of people who have died from opioid overdoses. First, it was opioid analgesic pain medications. Then it was heroin when people couldn't afford these street opioid analgesics. And then with the potency and the low cost of fentanyl, around 2017, the number of deaths we're seeing in the state of Connecticut increased and was greatest in that group. We've seen the highest number ever of opioid overdose deaths in 2021, which looks to have surpassed 2020's highest ever number by about 9%. And that's actually significantly less than many other parts of the country, where during COVID, opioid overdose deaths increased by greater than 30%. This slide identifies differences in opioid overdose death rate in various populations. And you'll see the blue represents pre-COVID 2019, highest levels in 2019, highest rate is in the non-Hispanic white population. By 2020, the highest rate is in the non-Hispanic Black population. By 2021, the highest rate of opioid overdose death is in non-Hispanic Black and Hispanic, greater than the Caucasian population. So when we heard of what happened in the school in Hartford, we were saddened, we were frightened, but we should not have been surprised with the amount of fentanyl that has flooded into our cities and into those populations. It may have been more surprising to have not seen it more frequently in our schools. This is to show you that there is a treatment for someone that has actually transitioned to having an opioid use disorder. First line treatment are the FDA approved medications like buprenorphine-based medications, name brand Suboxone, methadone, and naltrexone, which is an antagonist medication. If you're not on a medication, that's the red line, and you have an opioid use disorder, that is the death rate. If you are on a medication, that's the blue, significantly less, decreases the risk of opioid overdose death by greater than 50% to be on medication for opioid use disorder. Not everyone that uses fentanyl has an opioid use disorder. And this is a medication that is incredibly important, and everyone should know what it is, know how to use it, and have access to it. And that is naloxone, an opioid overdose reversal medication. And what naloxone does is it binds to that receptor stronger than the other opioids and knocks them off. So if someone is breathing has decreased, they're pale, their lips are blue, they're struggling to breathe, or they've stopped breathing, then this medication can keep them alive and give them a chance to get into some type of supportive treatment. And I'm going to turn things back over to Charles, and Dan's going to follow up.
Thank you, Dr. Allen. And tell you, it's just so informative. And we just have to understand that we are in this epidemic with this fentanyl, and it just doesn't matter who you are, where you are, you know, what color you are. It's just that deadly. And we just have to be aware of it, you know, within our communities and our states. And now I'll just turn it over to Daniel Bryan from Community Health Center. Daniel.
So much, Charles, and thank you, Dr. Allen, as well. Set me up quite well for what I'm about to talk with you all about now. Here we go. So I want to talk to you today about fentanyl risk, and I've sort of divided this up into a couple of different categories. Risks for use, what makes someone more likely to use fentanyl. Risks of use, who is at risk of overdose among our substance using populations, and the risk of intervention, like what are your risks as a person in the community who may not have a substance use disorder, who has a chance to intervene. So when Dr. Allen mentioned household dysfunction, there's a body of research around this called adverse childhood experiences. And adverse childhood experiences, to give a little bit of background information, because I can talk about this for days, is a term that was coined in 1998 by a couple of researchers out of California, Felitti and Anda, and a team from Kaiser Health. And the research got started because Dr. Felitti was running a weight loss program, and he noticed a high degree of dropout from that weight loss program. And when he started to interview folks about why they were dropping out, one of the things he kept hearing over and over again, that there was a ton of violence and abuse that they experienced as children within this population. So he began to kind of ask the question of like, well, what are the trends in this and how does it impact people's health? And they began to identify what they called adverse childhood experiences, or ACEs. And ACEs are abuse, neglect, and household dysfunction. Specifically, when we say abuse, we're talking about childhood physical, emotional, and sexual abuse. When we talk about neglect, we're talking about both physical and emotional neglect. And household function includes a variety of things, including parental mental illness or suicide attempts, incarcerated family members, domestic violence, family substance use, and parental divorce. So the original study had 9,508 people that participated in it at Kaiser. And I want to sort of drive home the point here that as important and as excellent as this research was, it was not representative of the world that we all live in. The people who were surveyed in the original ACEs survey were predominantly white. They were largely a middle class, and they were incredibly well educated, with more than 75% of respondents having some college education. But what they observed in this original study was a graded dose response, which means that the more of these experiences you've had, the more of those 10 things you had experienced as a child, the worse in general your health outcomes were across all kinds of domains. So what kind of domains are we talking about? Well, as people had more and more adverse childhood experiences or more and more ACEs, we saw the increase in both the prevalence of, meaning it's more likely that you had this problem or this challenge, as well as the severity of things including alcohol use disorder, COPD, depression, drug use, ischemic heart disease, liver disease, sexually transmitted infections, smoking and tobacco usage, suicide attempts, the likelihood you had more than 50 sexual partners, skeletal fractures, cancer, obesity, a sedentary lifestyle, and even early death is what we would find. So let's talk a little bit about what those risks actually are. The big sort of number for adverse childhood experiences is 4. They found this enormous jump in risk when people experience 4 or more adverse childhood experiences. So if you had 4 or more adverse childhood experiences, you were 1.6 times more likely to experience a broken bone, 2.3 more times more likely to have hepatitis than the general population or somebody with 0 ACEs, 1.6 times more likely to have a BMI over 35, 4.6 times more likely to be depressed, 12.2 times more likely to attempt suicide, 7.4 times more likely to have an alcohol use disorder, and 10.3 times more likely to have used injection drugs. right? So as we get into some of these substance use, categories here, you can begin to see the ways in which childhood neglect, abuse, and household dysfunction is this incredible predictor of people having a substance use disorder. So that the people that we're treating, the people that we're talking about, the people who are struggling with overdose are also people who struggled as children in their homes with violence, neglect, abuse, and dysfunction. The original study found that about 36% of people had no ACEs at all in the study. So while this is a big portion of folks, this is not even a majority of people do not experience household dysfunction. 26% of people had about one adverse child experience, 16% had two, 9% had three, and 13% had four or more. Part of the statistical analysis in this original paper by Flady and Anda found that if you were experiencing one, you were more likely to experience two. If you had experienced two, you were more likely to experience three, and so forth and so on. Not only were they predictors of worsening health outcomes that increased over time and over more and more of these, but they were also predictive of people experiencing more dysfunction. So when your parents had one problem, it was more likely that you experienced another. The question of how this all impacts people's behavior and impacts their, everything from substance use to health risk factors is not perfectly understood, right? We don't have an exact understanding of how this works, but the general thesis here is that when children experience adversity, when they're growing up, they have disrupted neurodevelopment. So all that important stuff that Dr. Allen was talking to you about brain development, when you introduce drugs to a developing brain, you have significant consequences down the line. You're more likely to experience a substance use disorder. But when you add trauma and neglect in particular, as well as household dysfunction and uncertainty and disrupted attachment, that brain doesn't develop the same way as somebody else's does. And when that happens, we see social, emotional, and cognitive impairments, people who may not achieve as well in school or who may have disrupted social relationships or, a lot of trouble maintaining and managing their emotions. And that causes people to adopt health risk behaviors, including smoking, alcohol use, drug use, injection drug use, et cetera, et cetera. So all of this stuff that we're talking about makes people more likely to pick a coping skill for them that helps them to deal with their emotions more effectively on a personal level, but also causes enormous health problems for them down the line somewhere. This leads to disease, disability, and related social problems, and ultimately potentially to early death. I really want to emphasize, going back, that what the original study found was that about 13% of folks had 4 or more ACEs. Well, I've had the privilege of doing research in our community. The Weitzman Institute and Community Health Center have begun to assess our patients going back to like 2018 for adverse childhood experiences, and I got a chance to publish on that research a couple of different times. In our community, instead of 36% of people having no ACEs, only 18% of folks reported no adverse childhood experiences. And a full 48%, almost half of our population, experienced 4 or more ACEs. This is a dramatic number. And in the literature, we were only the second people to publish on something that was anywhere close to this. Another study on TANF recipients, temporary assistance for needy families out of Utah, found similar kind of numbers. So we know that people who are more disadvantaged, people who are on Medicaid, people who are on food stamps, our friends and neighbors who are struggling financially and economically, the risk of ACEs being high in that population is incredibly high. Flip a coin, you're going to find somebody with ACEs 4 or more. So that's the risks for use, right? When you go through all that stuff as a child, when you have those kind of experiences, you are more likely to develop a substance use disorder, more likely to develop opioid use disorder, and as a result, more likely to come in contact with fentanyl. So let's talk about the risks of fentanyl. Dr. Allen did a great job talking about what happens in the brain and the nervous system and respiratory depression and all that kind of stuff. He even showed a similar slide I want to just point to, right? The amount of heroin that it takes for a naive user to have an overdose is pictured there on the left. And while that's not a lot by any stretch of the imagination, comparing that to the amount required for fentanyl is it's an astronomical difference. Importantly, too, fentanyl has not just a high potency, but it also has a very high affinity for the opioid receptor. So as a result, it clings very strongly and very hard and for a very long time in folks. And there are some nuances there that we'll talk about when I get to my section on Narcan. But most importantly, fentanyl's potency is incredibly high. Fentanyl is also a prescription opioid. This is not what illicit opioids are, but like you can go into the hospital if you're dealing with cancer or other really severe pain and be given fentanyl to help to mediate your pain. It's a very effective pain reliever, but the way that it is dosed is in micrograms, right? So a bag of heroin in the state of Connecticut, generally speaking, ranges between 0.6 and 1.0 grams. So super small amounts, we're talking in grams here. A milligram is 1,000th of that. So that 0.6 is like 600 milligrams. A microgram is 1,000th of that. So if someone takes a fentanyl patch, they're getting like 75 micrograms per hour. This is such an astronomically small amount of the drug being delivered to provide effective pain relief. And that is not what is in the street drug supply at this time, not even close. Importantly, though, fentanyl is increasingly found in other drugs. Tony mentioned, the cocaine-related fentanyl overdoses, and that is increasingly found in our community. People who use cocaine are at the most risk, other than folks who use opioids. Obviously, folks who use opioids are at the most risk there, particularly those who are recently recovered. Stories of people relapsing almost always have an overdose involved, unfortunately, because the potency of the drug has changed over time. And when we don't use, we have lower tolerance. So the highest risk is for people recently coming off of a period of abstinence. The second high risk is for those who use cocaine, because a lot of people who use cocaine don't have any interest in or don't use any opioids. In 2017, the DEA found that about 7% of all cocaine in the New England area was laced with fentanyl. That was more than 100% increase from 2016, where it was only 3%. Connecticut's done a surprisingly good job of tracking some of this data. And in 2018, we found a 420% increase in overdose deaths from the combination of cocaine and fentanyl in Connecticut. This is a huge leap up year over year. And while I don't have more recent data than that, the numbers continue to climb. So for folks who are cocaine users, they may or may not have a cocaine use disorder, right? It may not rise to the level of a full diagnostic problem. Their exposure to fentanyl in the cocaine supply can be a death sentence. And it's something that we really need to be aware of and help to educate both people who are in contact with people who use drugs as well as people who use drugs. And so the moral of this story, right, is that we have solutions for that. Dr. Allen mentioned Narcan or Naloxone, and I'm going to talk about that a bit more. And non-opioid users should be provided with this drug and educated on its use, because that can help make a difference, that can help save a life. Last year, you may have heard the story about cannabis being laced with fentanyl, and it made some really big news. There was a couple of articles about it. There were 39 overdoses in the state of Connecticut that were linked with fentanyl-laced cannabis. The good news is that this largely was debunked. It was not the case. 30 of these cases, folks who had said they had been using cannabis were probably dishonest when medical folks showed up, and they had a history of opioid use, and they overdosed from fentanyl, intentional use of fentanyl. It was the drug supply that was found in these situations was tested, and in only one single case, where 9 overdoses happened, mind you, so it was still a significant impact, was there any evidence of fentanyl-laced cannabis, and that was in Plymouth, Connecticut. So the moral of this isn't to say that there's zero risk of this happening, it's just that the risk is incredibly low. The newspapers made a really big deal out of this, like, epidemic of cannabis laced with fentanyl, and everyone was going to have an overdose, even if they were just smoking weed, and all of the problems with that. And certainly cannabis is a drug that creates a lot of problems and causes addiction in its own right. But the real risk of cannabis laced with fentanyl at this time is still incredibly low. But again, people who don't use opioids should still be given Narcan, should still be educated on its use and educated on what does an opioid overdose look like, how do I recognize it, and what are the costs and benefits of treating it. Well, good news, right? So what are the risks of intervention to you as a citizen who may know someone who uses drugs, may or may not have a drug use a history or challenge of your own? What happens if I intervene? Well, the good news is basically nothing. There is no risk to you in intervention. There is no legal risk. We have a Good Samaritan law. So if you are acting in good faith, trying to help someone and something happens, no risk to you on a legal basis. There's also been a lot of talk over the last several years. This is not new, going back to at least I think 2017. Hartford PD had a big story with this about airborne or transdermal absorption of fentanyl as a risk factor to folks in the community. So the basic idea is that if I put my ungloved hand on some fentanyl, it can be absorbed through the skin, and I can overdose as a naive user just sitting here touching some fentanyl. And this has been debunked. Why was this touted? Well, the real answer there is that it gave law enforcement the chance to upcharge folks who were dealing fentanyl by assaulting a police officer because they touched fentanyl or were in the room and allegedly inhaled it and then had an overdose or an overdose-like response or a fentanyl exposure, as it was termed. They could increase the charges and really put somebody who was using drugs or selling drugs in a very, very difficult legal situation beyond what is already difficult. The American College of Medical Toxicology and the American Academy of Clinical Toxicology have called accidental over this way, quote, a near scientific impossibility. So why is this important, right? Well, if the myth has been spread for the last several years that if you touch it or if you are just anywhere near it and you breathe in that you're going to have an overdose, why would then I want to help somebody, right? I'm scared about my own safety. They've been using, what if they snorted it and I touch their nose and it gets on my thumb and then I overdose and I don't want to die, so I can't help this person. I'm very scared of that. But of course, this is nonsense. It does not happen. It cannot happen. It is, quote, a near scientific impossibility. And I hope that you will all feel confident that if you intervene, there is no personal physical risk to you from the standpoint of overdose. Intervention saves lives, right? And so therefore fear of intervening helps to, increase the mortality of this condition. So what happens if you intervene and you use Narcan, which is the brand name for Naloxone? Comes in a couple of different forms. It can be injected or used as a nasal spray. I'm going to talk about the nasal spray version because that is the most easy to use version. The good news is that if you give somebody Narcan and they don't need it, nothing bad happens, right? So again, the risk here is zero. If I, as a person without an opioid use disorder who is not on any chronic opioid therapy for pain or opioid use disorder, if I were to take Narcan right now, I would feel nothing. Nothing would happen to me whatsoever. I would be safe. I would be fine. There would be no negative side effects. If I was in an opioid overdose, I would be brought back. I would feel better. And I would be able to breathe, and that's it. That is all of the possibilities about what Narcan can do somebody. Importantly, Narcan or Naloxone is a treatment for overdose, not for opioid use disorder, right? So if I have a heroin use disorder and I'm taking it regularly, but I have not overdosed, and you give me Narcan, I'm going to go into withdrawal. I'm going to be pretty miserable. I'm going to feel bad, but I am not any better off, not any safer, not any, not treated for my addiction. It only does one thing. That is to bring someone back for an overdose. It saves a life. So let's talk a little bit about how to use it, right? I have, let's see if you can see it. I have on my keys here, my Narcan. I carry it with me wherever I go. It is one of those things I hope to never use, but in the event that I see somebody where I might be able to use it, I know I can save a life, and I'm glad that I have it on me. So if you see somebody who's experiencing any of those symptoms that Dr. Allen talked about, they're looking sort of slumped over, their lips are blue, their nail beds are blue, they don't appear to be breathing, they're non-responsive, what do I do? Well, you start by going over, grabbing them on the shoulders, giving them a shake, and shouting at them, hey, wake up, can you hear me? If you get no response, then you give them the Narcan. How do you do that? Real simple. You pull the tab off the back of the package, take out the little nasal inhaler, put it up their nose, push the plunger. That's it. Very, very simple. Then you call 911 because in our current drug supply, fentanyl being an incredibly potent opioid, one dose of Narcan probably not going to be enough. I've only had to do it once, but it took multiple doses to bring the person back. But when you give it to the person, it still does throw off those opioids off those receptors. and it still buys them a couple of good breaths, it can make a huge difference, even if they immediately go back to being non-responsive and not breathing. So just because you only have one dose doesn't mean you shouldn't use it, even if it takes 2 or 3 or 4 to bring somebody back, right? That's why we call 911, because I, as one person, cannot be an entire pharmacy. It is unreasonable to expect me or anybody else to do so. So I give the dose, and then I call 911 to make sure that they are safe. Also, put them in the recovery position. Real simple thing, not hard to do. Kick one leg out, as you see down there in number 3 on the slide, and you roll them onto their side so that they are not getting any positional breathing difficulties, right? When people slump over, they can contract in the waist, and the diaphragm doesn't breathe as well. So by putting them in this position, if they vomit or whatever else, they are safe, they are breathing, they're in the best position, and then you just wait with them. Simple as that. Couple of quick notes about Narcan before I wrap up and hand it back to Charles. Number 1, it does have an expiration date. In general, when drugs expire, they get less potent, but they don't become dangerous. So you can hold on to it for up to 6 months after your expiration without a whole lot of risk. Number 2, it does have a temperature sensitivity, so don't leave this in your car, please. It does go bad, especially if it freezes, not necessarily at the high temps as much as the low temps. And God knows New England winters here. It's 50 today, it may be 32 tomorrow. And so if I had my Narcan in my car, it would not do as well. Plus, if it's in my car and I'm in a store and I got to sprint out to the parking lot and sprint back, that's several minutes. Somebody is not breathing if I'm the person who's going to treat them. So I hope you'll consider carrying Narcan. You can get it from your doctor or from your local pharmacy in some cases. It is safe to have, safe to carry, and you might save a life.
Okay, thank you, Daniel. That was very powerful, and thank you for the information, but also thank you for the information on the misinformation that we sometimes receive as a community, and there's a lot of things that is being said about the fentanyl out there, but to have the right information is to continue to win the battle. So thank you so much. And up next, we have Reverend Robin Anderson of the Ministerial Health Fellowship. Good morning, Robin.
Good morning, everyone. Thank you so much. What a wealth of information that has been given to us by Lisa, and also by Dr. Allen, and then also by Daniel. What I'd like to, my part in terms of talking to you about is really the community response to the danger of fentanyl, and how is it that we as a community can respond to it. Next slide. So one of the things, as you all know, I am a minister, and so I always undergird myself with the scripture, which is taken from Jeremiah 29th chapter, verses 11. Taken from the Christian Standard Version. And it says, "For I know the plans I have for you, declares the Lord, for your well-being, not for disaster, to give you a future and a hope." And so one of the things that we have to also remember that no one woke up one day and said, I want to use fentanyl or any other substances. No one woke up one day and said that I'm going to overdose from fentanyl. So we want to make sure, but also to know that, that was never the plan. That's not the plan. The plan for us, as far as I am concerned, and my faith is for my well-being, and also not for disaster. And so one of the things that I think we have to do as a community is to think about what are some of those ways that we can avoid disasters, and what are some of those ways that we continue to look for and find ways to help people with their well-being. Next slide. And so as we know that, it is a dangerous time that we're living in, and as we also saw the number of overdoses, and especially the increases of overdoses that have happened, the question becomes for all of us, now is that what are we doing? What are we going to do about it? Are we doing enough about it? What is the plan now, and what is the plan for the future, because as we know and look at the fact that we're dealing with fentanyl now, but at one time we were dealing with crack cocaine, we were dealing with heroin. And so drugs have been in our cities, on our streets, and in our communities. And so the question becomes, when people are in crisis, no matter who you are, no matter where you are, whether you're a church, whether you're an organization, or whether you're somebody walking down the street, what are you going to do when you see someone in crisis? And especially as we talk about those persons that are overdosing. And so thank you, Daniel, for also really giving us a lesson on Narcan and really how to use it. But also we have to be intentional about making sure that we have a plan to teach others and continue to teach others, and that we are savvy ourselves and being able to deal with crises that go on. So the question becomes, do you have a plan? And how are you going to work the plan? Next slide. One of the things that, really we know that fentanyl has affected persons individually, also the family, and also the community, and et cetera. Hospitals, it's affected each and every one of us in some kind of way. Next slide. One of the things I think we have to always remember also that we are also in recovery, or we should be in recovery from something. And so many of us, whether it's divorce, whether it's loss of a loved one, those of us, we heard Lisa today who lost her son due to a fentanyl overdose. We also know that even during COVID-19, we all have suffered an enormous amount of deaths, or persons that we know that have died from the disease. So basically all of us in some kind of way are in recovery or in need of recovery. And so that should put us on the same line that everybody needs our assistance, that everybody is going through the same kind of thing. Next slide. And so I was glad that I heard the adverse childhood, also that Daniel did such a good job in explaining that. And one of the things that he talked about was the actual trauma. And so all of us are dealing with, or somewhat dealing with, the aftermath of trauma. And as I think about even a person of color, and also dealing with, as you talked about, adverse childhood trauma, I've also all experiences. I mean, just growing up as a person of color, also all our lives we deal with trauma after trauma, or just the whole trauma of being a person of color, and not necessarily always being accepted, not always opportunities that were not given to us, not always being able to go to the best schools, not being able to, or living in poverty, and all of those kinds of things. And then also on top of it, also being in the midst of seeing violence happen, wondering not whether or not you were going to be a part of that violence, living through domestic violence, and also sexual abuse, and all of those kinds of things. I myself am a survivor who is thriving due to a horrible rape that I received as a child. So basically, as you think about just trauma and some of the things that you're going through with trauma, and the fact that the next slide, that past and past trauma, and even trauma that you may be experiencing now, also as it relates to those things that you are recovering from, such as racial trauma, not knowing whether or not, even as a Black male, and as we looked at also the fact that the number of Black males that have overdosed has skyrocketed. And also just even as we think about even what happened with George Floyd and some of the, police, the racial violence that has occurred, but also just living every day, not knowing whether or not you're going to be stopped by the police, not knowing whether or not doors are going to be open, or to have been not given opportunities that you thought you should have because of those things. So racial trauma also is something that I want to make sure that we really understand that that is real, and that is something that we live with, every day. Also, those persons that have dealt with other kinds of traumas that they experience, they deal with those things every day through flashbacks, through dreams, and through other things. And then also grief. And like I said, as we look at even what we've been through with COVID-19, and all of the things that we have been through also as well. And so a drug like fentanyl that comes in because of many a times, a lot of it is also that we want to numb ourselves. We don't want to deal with some of the flashbacks, some of the things that we're experiencing, and also to be concerned and scared for our lives, not knowing many Black males concerned about whether or not they'll live past 25 years old, or whether or not the same thing can happen. And one of the things that really struck me about this whole thing was a young man named Amir, who basically during a discussion that we had with young Black males said, sometimes I wonder, what I should do. Sometimes I'm scared, I'm afraid. And so I could easily myself pick up fentanyl. I could easily myself pick up alcohol or drug or any kind of substances to numb my pain, because I'm concerned about whether or not I really get to live, not only just past 15, but whether or not I really get to live at 20. Those are some of the things that people are really dealing with and are concerned about. Also, and even as I thought about this young man, we talked about this also, those children that were 13 and 12 and 11. And so people were saying, well, how in the world could they have drugs, and how could they, be a part of that? And so when you think about some of those things, why would they have so many of them? Well, not knowing whether or not you're going to eat the next day, or whether or not your rent is going to get paid. So we don't know what kind of condition or what kind of impoverished condition. And also it becomes about, economics. Nobody wakes up and says they want to sell drugs. Nobody wakes up and say that they want to be carrying fentanyl. I'm just going to try it, or I'm going to experience. So some of those things I think we have to really think about and look at, and also think about how are we going to address some of those things, as well, that leads people to using fentanyl. Next slide. And so these are just some of the things that we know that when people, deal with trauma and, just some of the signs and symptoms, which I think Daniel really did a good job with some of those things and how it leads to possibly using substances. So I want to go to the next slide. And so the question becomes, with this fentanyl epidemic, an opioid epidemic also, and just the fact of how things become epidemics. Because as I think about also being a person of color, many years people were ODing from heroin, like I said, crack cocaine. But then as we see now with this deadly and the danger of fentanyl, and just the rate of overdose and the fast rate of how that has happened, also, I think it really requires us as a community to really look at how are we going to deal with this? What is going to be our response to that? And so, as we talked about even earlier, some of the things is around, really, really getting resources. What are some of the resources that the community can provide? What are some of the resources that are actually needed? And thinking about really the persons that are actually using fentanyl, the persons that are actually using substances, the persons that are really challenged with mental health that may be also using substances or fentanyl because they don't want to feel the pain that they're going through. They don't want to continue to have the flashbacks of the trauma. They don't want to have this feeling of not knowing whether or not they're going to live or die because of the color of their skin. Also the impoverished situations that they find themselves in. And so as we look at the fact that we need help. That's what they're basically, I need help. And so, yes, we want to make sure that we have those things that prevent them from dying and to reverse the overdose through Narcan and some of those things. But even once I come, what are you going to do about those things that will help me to continue not only, and as we talk about harm reduction and making sure that they're able to use safely, because we know if they're alive, then there's another opportunity for them to get help, but also to get the things that they need and possibly to get their lives back on track. And so these are some of the things that I think that some of the things that we need, that people go through. I need help. I got legal issues. I don't know whether or not I'm going to live, but go to jail today or tomorrow. I've been through jail. I keep going through this cycle, and it just doesn't seem like nothing can happen. Persons need employment needs. So, I've been looking for a job, and sometimes because of my size or the way I look, or because of the color of my skin, because of my educational level and not having those opportunities or those cognitive difficulties that were discussed even earlier, how I need help. And then also understanding that there's limitations in terms of, even if I decide that after I come through and I decide I may want to go get some help, where am I going to get it from? Really being able to have access to services. Do we have enough access for people to be able to get services and things? So these are some of the things that we also need to think about. I need help. I have spiritual needs. I have medical concerns. I have dental concerns, all of those things that require me to say, I need help. And so the question becomes, as a community, how are we going to address these things? How do we work together to make sure that when we get that, we are able to not only, we definitely want people to live and prevent them from overdosing. And even if they overdose, to reverse that, but also how do we come as a community to provide these resources that are also needed, for persons to live, knowing that, there are resources and things that they actually are looking for and actually need. Next slide. And so again, when we look at also just the kind of stabilization, one of the things that we also have to make sure that we do, and we don't even realize that sometimes we do categorize those things, but also to be able to see people for who they are. They are who they are. They have dealt with what they've dealt with. They come to you before you, and to really look at this person and say, this is a person, this is a human being, and I want to make sure that I can do whatever I can. I want to make sure that they know that I am there, for them. So we can't be judgmental, also, and then also being able to really meet people where they are. And then also affirming a person's worldview, also, and then also really helping people to develop a relationship that fosters, mutual respect, that we have those kind of relationships of mutual respect. And then also respecting people's privacy, and anonymity, allowing them to know that whatever they, when they come to you, or however they deal with you, that it won't be a public thing unless they want it to be public, but also that we, really think about them and think about their anonymity, and allow them to feel like that they have integrity, that they have value, also when we come to them. And even those that, that's why it's so important to have harm reduction, also, and also being up to be able to embrace that. It's better to help people to stay alive and to use safely. But the ultimate goal, yes, is to kind of help them to meet their needs. But also the main thing that we want to do is we want them to live. And so whatever we need to do to help them to live. And that's why harm reduction is so important, also. And so learning about harm reduction and embracing harm reduction, because you do have people that are anti-harm reduction, of harm reduction, but harm reduction does help people to live, also, and to be able to get to that place, till they get to that place in which they decide for themselves that they want to change their lives. And so what are some of the things that we can do as a community to help people to overcome and to really from deaths of fentanyl? What are some of the things that we can also do, as a community? And so I think that one of the things that the community's response to it is to have harm reduction programs, is to be able to put resources and put funding into places that will continue to fund harm reduction all over the state of Connecticut. Also to increase the recovery supports that are there. And also one of the things that is so important in those recovery supports, that we do have peer support, that we do have recovery coaches. It's great for myself and others that are involved, but sometimes somebody that has been on that path, that has walked that walk, also are more equipped and better to actually walk with someone else. And so to be able to develop those kind of peer support and to increase the development of them. And one thing I can say about Connecticut, that we are working on that, but I think we still have a long way to go. And that's why opioid task force are also important, that we come together as a community and we look at what do we have here? What are some of the things that we have in place? What is not available? And then also, even what is in place, how do we collaborate? How do we work together to be able to address those things? Who should be on the ground? Who should be in the place where, they may be providing the educational part of it? Who should be in the place in which they're making sure that people get trained and Narcan is available also to persons? So basically being able to, come together really as a community and really with one mind, and that is that we're going to help people to live, and when we're going to make sure that we do whatever we can to help people live from fentanyl, and we're going to decrease this high number of overdoses that continue to happen, especially as we see the numbers rising up in the Hispanic and also Black community, but all, what are some of the things that we're not doing that we could be doing? What are some of the investments that we have that we have not fully invested in the way that we should invest in those programs? And so the question becomes also is that how, what else can be done? What are some of the things that can be done? And so we want to also limit, making sure again that people are not, able to get so easily prescription medication with opioids, knowing that it may be detrimental to them. Also, we can look at also, and I think that I like that demand zero, reduce and look at ways that we can reduce opioids, such as fentanyl being able to come into our state, into our communities. And then also to help, seek treatment for opioid misuse, but also being able to really open those doors, because there's many places and many services and many treatment programs that don't really take persons with opioid use, or depending on how much they're using and how they're using. So how do we extend those services that we're actually, have, so that we might meet the need? And also to make sure that we continue, every community, every city ought to have and be able to deploy a harm reduction staff, harm reduction team that are on the streets every day in every city and every town, to make sure that we're able to get to and hand out those things that are needed to keep people safe, and to also make sure they have that they have Narcan, that they have fentanyl strips, and all of those things that will continue to keep us safe. So the main thing that I'm really saying, that this response to the danger of fentanyl requires each and every one of us to do our part, to really come together, to advocate for those things that are needed to reduce or to even not have any fentanyl overdoses in our communities. And then also to be able to have programs that are readily available and doors are open, resources, recovery supports, people on the ground that will continue to address this fentanyl epidemic, this fentanyl tragedy, this fentanyl things that are taking over now even our children and our community, that we might help people to live and not die. So let's get to work as a community. Let's work together. Let's do those things that will keep our community safe, that will help people to be safe. But most of all, that it won't be an epidemic, but it will be a victory, a fentanyl victory, because we have addressed and we have made sure that we came together and collaborated and provided those resources that will address this thing, that will reduce those numbers that we continue to see on the daily basis. Thank you so much. And also, I'm so glad that Anna will be coming, Anna, to talk about that program. We need programs like hers that are on the ground that continue to go forth as we continue to deal with this opioid epidemic. Thank you.
Thank you, Reverend Anderson. And I just can't say enough about all your passion that you have in definitely in working within the community. And it is just so pertinent that we understand that it does take a community to combat this enemy that we're facing. And, and even in my own early recovery, if it were not for the community here in Middletown, and I don't know where I would be today. Of course, I give honor to my Lord and Savior, Jesus Christ, for allowing these agencies and people that he's put in my life to be in place. And I can't thank you enough, as I said, this morning, what an honor and a privilege it is to sit amongst this panel, not knowing 16 years ago, coming out of prison and coming out of recovery, where I would be. And just making it aware what Daniel said, I faced a lot of childhood trauma in my own life, and we have to understand that just because a person is addicted, that there are always underlying reasons as to why. And if we can get to the underlying reasons, then we can get to the basic root of the problem and hopefully, put a curb on this fentanyl that's ravaging our communities. So thank you so much for that. And thank you for your passion. And our final speaker will be Anna Gopian from Tri-Circle Incorporated. Thanks, Anna.
Thank you, Charles. And man, I'm so honored to be here and the anchor for you guys. I appreciate that. Tri-Circle, I am Anna Gopian, the executive director and founder of the organization. Really wanted to highlight, I can just go back and highlight all the things that touched my heart from the presentations prior, all the way from Lisa and right down the line. So thank you. And I think the collaboration and the complement that we have and passion for each other in this cause is super important. So I'm really, really happy to be here. And in regards to this presentation, I'm going to take it to a point of the individuals, but the families, guardians, and loved ones, and the community support. That's so super important for us to be able to get to another place with numbers that will drop in loss because they've done nothing but go up. And I think it's really a great opportunity here to have this tool and this webinar, something that can be shared too after the presentation. So thank you again. So Tri-Circle supports individuals and families that are affected by substance use disorders or the disease of addiction. It's heard in a couple different ways, a lot of breakdowns in the medical terminology and the acronyms that fly around regarding this, services and or supports or medications. It can be very confusing. So it's really important. Then what we want to do is through the education, community engagement, Tri-Circle is dedicated to providing the tools to build strong futures. And we think it's a great opportunity. And as I say, an honor and a privilege to work amongst folks within the 15 monthly support groups that we provide. Now we have them not just back to in person, but we've kept the connection through the virtual platform because that was one place that some people came for their first time, and we wanted to make sure that we continue those relationships and also made available at times and geographically, some people aren't as close. So the virtual option is a great thing to have for people. I'm going to better explain each one of these groups and some of the additional things that we provide, but there are 6 separate Hope After Loss groups across the state, meaning in different locations, and 9 hope and support groups. Now, Hope After Loss groups became Wallingford in 2013 to help start their first hope and support group. And what became apparent is that the numbers were going up and not everyone was making it. So these groups became so important to start because it's a different demographic with a different kind of need. And it was really important that folks were getting what they needed in 2 different places. They come together and we speak about folks that have passed and we bring them to light in conversation and take all of the lived experiences these folks have been through, families, siblings, guardians, and we build them into the solutions. So when it comes to these groups, they are in 3 different towns: Middlefield, Berlin, and Putnam. So right now we have 6 of these meetings. And again, they're still accessible because we kept the virtual option in all of them. And online on our Facebook page, these would be the announcements that people would get online to know how to get in contact with the person that can send them the link, because we are, protective of the people that facilitated by 2 paid professionals. And that was with the support of Department of Mental Health and Addiction Services and the towns and funders that we have got together. And Christine is one of the professionals that co-facilitate these groups. One person is licensed and the other is a paraprofessional, and all of those are listed on our website under supportive professionals. These brochures are also recently updated to include a QR code where folks are able to get brought right to the website and all of the addresses, days, and times. So yes. Another thing that's come out is the Memorial Scholarship, and it was in the second. Christine Gagnon, Mike's mom, she's actually our board chair right now. And this will be the second year we've been able to increase to 2 $2,500 scholarships. So the information for this is also on our website. There's a whole committee of people that have come together that have been impacted and lost loved ones. And they are the ones that oversee, the scholarship winners and the submissions. And we are able to highlight and honor them in different events and as our year goes on. Another way that we're able to not just honor loved ones that have passed, but really support the conversations, open up the dialogue. This is a conduit kind of to have some of those tough conversations. Stigma, shame, guilt for both hope and support and hope after loss are different, but really important that we continue the conversations and make sure that folks are not gone in vain, that the families get their support. If they have lost someone and they are here still in this earth with us, we have to make sure that they're included in the conversation when we treat the whole disease. So the remembrance quilt was how our memorial quilt was inspired, and that was at Clearinghouse. I heard about it in the Department of Mental Health and Addictions, and we took it from there. People that we already had, worked together and created their square. So there's 50 folks here, but every quilt has 36 squares on it. I'll go to the hope and support groups. Now there's 9 of these meetings each month, and they're in 5 different towns: Middlefield, Summers, Southington, Putnam, and Wallingford. Now the difference here, there's a couple of them. They're different formats. We created our own format. We believe that we complement other organizations and pathways of our website. For the most part, other resources made available, because we're not available at every time and day where folks might need somebody. So in Middlefield, for parents, guardians, and loved ones that have someone in their life affected by the disease of addiction, there is a meeting happening. And once a month, we pick one of our groups, Hope and Support, to have a speaker. So tonight there is a speaker, and that would be a person in recovery, and they will share a little bit. They're able to, respond back from folks if they had questions or concerns or similarities that might have touched their heart. And we will be able to add you to the list if it's something you choose to participate into again. And it would be my name or email address to get included into this particular group. And Hope and Support groups are also listed on our Facebook page when they're going to happen. So you can get like a reminder, and it's done through a CC list on email. And these are the different towns. And this is one of our volunteers that's created these postings for us. There's a lot of work that has to go on to have these. I'm not, you're definitely aware of that. And I'm not singing to the choir when it comes to the great appreciation we have for volunteers in this world and this, the community resources that we have. Additionally, in our Hope and Support groups, we do make Narcan or available in the Deterra drug disposal bags. Leaves with Narcan, not just better understanding the process of how to, go through the administration of it, but we give them a piece of literature that Emergent Biosolutions, the company that now owns Narcan, has provided. It's called Be the One Before 911. So there's a QR code that leads them right to the video that also will show someone if they're bringing it home to another family member, or they're able to share the information, and they can come up with a place in the house where the Narcan is available. Also, we have 12 panel drug tests for only $5, which is really important when it's, you're talking about regaining trust or boundaries and learning how to have a conversation when someone that is affected by the disease of addiction. And we say in the groups that we don't necessarily want to catch you doing something wrong as much as we want to catch you doing something right. And the thing about these tests, not only it's positive, negative, however it's looked at in an MAT program, that they should be testing positive for it. There's also fentanyl on these as one of the strips, and bringing that to light would be able to help initiate a conversation regarding maybe a harm reduction or information, how folks were able to share here today that cocaine and other substances, you think you're taking an Adderall and it's straight fentanyl, or you think that you're taking a Xanax and it's straight fentanyl. So it's infiltrating so many substances. So it opens a conversation if it's someone which we make available for only $2, and those correct outcomes and all of that is very high, and it's very quick, 15 seconds. And we again use that as a tool, especially if you have a young adult that is out and about and drinking. So there's exposure to what's in your system, and it is again another tool that we can use to open conversations and help young people get out of sticky situations. If they're speaking with a friend, hey man, let's use this, let's go do that. Well, my mom when I get home. So it's a really way to young adult. These brochures too for Hope and Support are also online in a PDF format. We do have them in print, and we have pocket cards made available now. If anybody is interested, I can, you can come to our office in Middlefield, or I wouldn't have a problem meeting someone in the community and having further conversation. In back 2020, in December, we were able to start offering services made available master level licensed clinicians that we're working alongside with. Have telehealth options, so if it was something that was needed and you're not in proximity, you have that as well. We had just finished up a DBT group, and we look forward to starting in the near future another group. And we'll post it on Facebook, Wellness Professionals, on our website, and let folks know that we are doing it. So our clinical services has its own brochure, and you're able to see that online as well. So here's another thing that I feel, and I know others have said it and believe the fact that the opposite of addiction is connection. And what better way to do that is with events and, you know, gatherings of people, civic organizations, you know, clergy, all the different people that make a difference and touch one piece of someone's life in one way, shape, or another. And it really provides the opportunity to say, thrive when we're, so the more inclusive is say that diversity in many different, actually everybody does, we do, that's why we're all here together, right? Because we have such a great complement of resources. So some of those things, not only today, but we were able to be part of the webinar series that Demas just had. We have, well, we play Setback. I don't know if anybody likes cards, but that's fun because sometimes we just got to talk about something not related to a substance use disorder. And we do this in a community location. It's just a lot of fun. And it helps Tri-Circle too. Different parts of the state. We just did a presentation and worked along with another organization, Tri-Circle Restoration and the Paraphernalia Project. We were able to work along with the town of Southington. The Elks in Wallingford we've been working along with them and having different training opportunities and presentations when we bring in speakers. Again, the Quilt Project, we make ourselves available. Our next one will be up in Plainfield in April 2nd. So that will be listed soon. Other people are able, you know, try to get around the state and let people know that it's available to them. And then we have coming up on March 30th, the end of this month, it's already posted on our website. This is for an education about one of the withdrawal management medications that not many people know about. So we wanted to make sure that folks had the opportunity to learn about it. And the ORN, the response work that are ending now that will be out for August or September. We have is another great way to not just let folks know about what we do, but also let you guys know about people we're aware of, and volunteers, our new clinicians. We spotlight guests, we highlight a book of the month. We have, you know, different people in a whole team of folks that really come together to make this happen every month. And it is archived on our website if you guys were interested in seeing it, and then how to sign up if you'd like to have it in your email once a month. So I'm going to close with the fact that Lisa D and covered some time that we wanted to share about, you know, hope after loss, but also we were really happy that she was able to share about Finding Hope, the short film that she had done. It's powerful, it's impactful. We hope that it gets into the hands, including junior high schools. And I want to make sure that I'm able to say, you know, looking at what Dan put up against the adverse childhood experiences is super important. I say regularly that drugs aren't necessarily the problem in most of the cases. They're the solution. It's depending on how you're looking at it. And it's the story before the story that we have to allow for safe spaces for people to talk about. Because if we're not getting to that, which may be the core, and we're just like taking care of symptoms as we go, keeping people trapped in the recidivism and the cycle of addiction, then nothing's going to change. So I really like the fact that it's getting, like, ACEs is being talked about more often, and that people are able to speak up more with, you know, the strength and courage and support that organizations like everyone here today has available. And, you know, it takes time. Recovery doesn't happen overnight. And in the very big front slide there, I was able to share that I found my own recovery in July 13th, 1995. Medication-assisted treatment was eye-opening for me when it started to be brought into the conversation. It was a different path than I chose, and I'm grateful that I had the willingness to start doing more research in my own way to find about additional pathways. All of these that I'm aware of talk about really, I am with folks, parents, guardians, and loved ones. Our board of directors has 8 people on it right now. 4 of them have lost children and loved ones, and the other folks are definitely all been affected. We're together with a base of passion and empathy and better understanding of what's needed. We are the peers, and I really think it's important that that voice stays at the table. So I'm going to say thank you to Middlesex County Chamber of Commerce, which oversees the REP program, Recovery Employment Program, all of the presenters, MCSAAC and DEMIS, Department of Mental Health and Addiction Services, for allowing us to participate in another drug awareness webinar. Because, yep, as I said before, together we are stronger. Thanks so much, guys.
All right. Thank you, Anna, and thank you each and everyone, and we so appreciate it. And again, you know, it takes a community for us to combat this enemy. So thank you all. And I'll turn it back over to Johanna.
All right, thank you so much. I really can't thank everybody enough for this presentation. Every time I sit through one of these presentations, I learned so much from you all. And we will be sharing all the presentations following this via email, along with an email address for Lisa Dean for the Finding Hope video. So we'll be doing that in the next few days. I think Charles and a lot of you actually said it best. It truly takes a community, and we're so fortunate to have such an amazing support system in Middlesex County. So for now, I'm going to open it up to questions. If there's any questions, please use the Q&A or the chat function at the bottom. Everybody's quiet. I think you guys just answered all their questions because you did such a fantastic job, to be honest with you. So if you have any further questions, please just shoot us an email. Like I said, we'll be sending this information to you shortly, so watch your email for that. But thank you all truly from the bottom of our hearts at the Middlesex Chamber. We are so fortunate to have you all in our community. So everyone have a great day. We just got a response. Thank you for such valuable info. Take on the day. Be blessed, everybody. Have an amazing day, and hopefully you get to enjoy some sunshine. Thank you, everybody.
Thank you.
So what